Good afternoon and salam everyone. Assalamu alaikum wa rahmatullah. I'm Dr. Alamgir Kabir. I'm not physician but physicist. I did my MS in Jangnagar University and Master of Research in Biomaterials from University of Birmingham, UK. And then I completed my PhD from University of Toledo, USA. Now I'm working as an associate professor in the Department of Physics, Jahangirnagar University. Uh, Today, I'm going to talk about my research on applications of lensless digital holography in chemotherapeutic drug screening. So especially I work on device and I use this device to screen the drug, especially chemotherapeutic drug. So let's begin with the cancer. This cancer is uncontrolled growth of abnormal cells, and there are several treatment options for this for this cancer treatment, like hormone therapy, surgery, bone marrow transplantation, chemotherapy, targeted therapy, radiation therapy, immunotherapy, and so on. So chemotherapy is one of the most common anti-cancer drug treatment, and more than 90% of cancer mortality is due to drug resistance. Drug need to be developed to kill the cancer cell, specifically the drug-resistant cancer cell. And for that, we need a device so that we can screen the drug with high throughput. And different drug induce different types of cell death, and we need to know the cell death pathways. And that's why I use my device to detect the cell death mechanism. Let's say what is cell death. Cell death is event of cell ceasing to carry out its function, and it can happen in programmed way, which is called apoptosis, also in unprogrammed way, which is called necrosis. In apoptosis, the normal cell starts shrinking, and then next step is start blebbing, and this bleb, these apoptotic bodies are taken away by phagocytosis process. In necrosis, the normal cell start swelling. It becomes bigger after that. So normal cell start swelling, and then this membrane start rupturing, and then cellular component can come out of this cell. This is necrosis, and this is very violent way to kill the cell, and this is very good way to kill the cell. So identification of apoptotic versus necrosis cell death is very important, especially during therapy. And during necrosis, so release of cytoplasmic fluid come out of the cell, and it gives rise to inflammation, which is very harmful. But in apoptosis, the apoptotic, I said, the apoptosis is very nice way to kill the cell. And we always target to kill the cell in apoptotic way so that it get less harm. And other importance of apoptosis are understanding pathogenesis, drug screening, apoptosis remove unwanted cell. Dysregulation of apoptosis cause disease, neurodegenerative diseases like Alzheimer, Parkinson, and so on. So there are conventional way to detect the cell death. One of the gold standard method is Western blot. In this Western blotting technique, you need to load the protein of interest and then run the gel. You know these protein are negatively charged, so if you put the negative terminal here, then it will repel, and this protein will go through this gel. Depending on the size, it runs through the gel, and then transfer the protein into the membrane and do the blocking reaction to get the targeted protein to detect the cell death. The other gold standard method is enzyme-linked immunosorbent assay. In this case, you need to use the antigen on the plate and then use a primary antibody to bind the primary, to bind the antigen, then need secondary antibody with enzyme link on it, and then use a substrate, it's chemical, and do this reaction and get this absorbance, and you can detect the cell death pathways. All of those methods are label based. That means you need label, but there are some label free technique as well. For example, uh, imaging, so on. These methods are not high throughput method. It takes several days to complete, and it needs resources, also labor intensive. And this experiment, to do this experiment, you need special training on it. So I can say these are not high throughput method. So there are some imaging and spectroscopic method as well. In imaging method, you can use the electron microscopy. In this technique, you need to fix the cell at different time point to preserve its structure, and then use the electron gun, produce the electron, and then image the cell. And you can get the high resolution images to see the bleeding and all of this hallmark of this apoptotic cell. Also in necrosis, you can see the cytoplasmic membrane is, component is coming out of this cell. Although this method is a high resolution method of imaging, but you need to stain the cell, and cell need to be fixed at different time points. Also, it's time consuming and limited field of view, means you can image like several cells, like 5 to 10 cells at a time. So this is not high throughput method as well. Here, we can use fluorescence microscopy as well. In this case as well, you need to paint the cell with different dyes. For example, to get the apoptotic cell death, if you want to see the apoptotic cell death, you need to stain the cell with annexin 5 dye. And to see the necrotic cell death, you need to stain the cell with propydium iodide. And propydium iodide go inside the cell and bind to the nucleus. So all of these methods are label-based method. Here you need uranyl acetate or some type of radioactive substance to stain the cell. It's time-consuming and tedious and not high-throughput method. Here as well, so you need some dyes to stain the cell. Also, this dye also interfere the cell activity. Phototoxicity, another problem here. Also, it's time-consuming and tedious. So now we can say that we need some sorts of device or some way to image or to detect the cell death mechanism without any label. There are some label-free technique as well. As you can see, atomic force microscopy, dark field, phase contrast, Raman spectroscopy, IR spectroscopy, so on. But the problem is, all of this method can image only few tens to few hundred cells at a time. So it's not high throughput method. So there is a need for monitoring huge number of cells to get statistically significant result. That's why here we explore a method for monitoring more than 1,000 live cells at a time. So our method is lensless holographic microscopy. You can see here we use a CMOS sensor. It's commercially available. During this era, because of mobile phone technology, we can get the CMOS sensor easily from any camera. And then we put the cell on the petri dish and use a LED light source, which is commercially available. It's very maybe maybe $1 or 100 taka. You need optical filter and pinhole, then image the cell. So the technique here, some of the light is scattered by the cell, through the cell, and some of the light passing through the transparent part of the cell and produce interference fringe on the CMOS imager. And using that fringe, you just reconstruct the images. This is the hologram. This hologram contains more than 1,000 live cells, and just image live cell with different time points. And then reconstruct this image. You can use the amplitude reconstruction or phase reconstruction to get these images. Advantages here, no lens is required. That's why the high field of view. Its field of view is more than 10 millimeters square, and you can image more than 1,000 live cells at a time. Also low cost. You can build it with $200, around $200. It's portable. You can take this device in your backpack and go to the resource limited area, and you can image the cell here with this microscope. Also, digital focusing is possible. In other microscope, you need to do the manual focusing with this knob. Just focus in and take image, focus it, take image, and you need lots of time. But here, you can just turn on this camera and go back home. It will take automatically image every 1 minute or 10 seconds, whatever you set, and then come back to the next morning and just put it in the software. It will automatically reconstruct the images, and you will get the images. And live cell. Sorry. Oh. So this is our microscope. This microscope is around 15 centimeter high and around 14 centimeter wide. And we use this drug, chemotherapy drug, different drug, and we screen it with this. Because of time constraint, I am making it short. At first, we don't use any types of drug, and then monitor it around 2 hours, and there is no change in cell. But when we use the reptinol, one of the common drug, and then you can see, so with the time, the cell is shrinking, and then apoptotic bodies is coming. So this is apoptotic cell death. Again, another common drug, you know, the doxorubicin, if we use it, and then we can monitor it over time. The cell is shrinking and bursting. This is also apoptotic cell death. If you use the hydrogen peroxide, I think everyone know about the hydrogen peroxide, which is very devastating thing. If you use this hydrogen peroxide, look here, cytoplasmic fluid is coming out of the cell, and this cell, all of this component is coming out of the cell, and we can image with our microscope. Another drug invented by one of the professor in University of Toledo, and we use this, and we see this non-apoptotic cell death. There are other types of cell death like necroptosis. It may cause the necroptosis cell death. Based on the morphological studies, we just produce a network so that we can automatically classify the cell death, and then we just crop the video smaller section and pass to this LSM network. We make this, and then we put in, softmax, and then we can automatically classify the cell death pathways. And this is the confusion matrix output from our network, and we can see our network is accuracy is more than 93%. So lensless microscope was built, and automatically we just classify cell death pathways. We can use this in research limited setting. I want to thanks to this group of people, our collaborators, and thank you all. If you have any question, please feel free to ask, or you can contact me. Thank you.